Hi, I'm Morgan, and I'm going to talk to you about tetanus. Have you ever stepped on a rusty nail and had to get a tetanus shot? Tetanus not only affects horses, but it affects humans as well. But don't worry, it's not that it's contagious, but humans can still become infected. That's why we have to vaccinate even ourselves for tetanus. So let's first talk about some what causes tetanus. It's a bacteria called Clostridium tetani. It's found in the intestinal tract of feces and of horses. Horses are most susceptible to it because their environment, they live in not really the cleanest environment, and they have a tendency to become injured. The bacteria is anaerobic, which means it does not need oxygen to survive, and it can survive a really long time in the environment. It also is rapidly multiplying once in the tissues and the injury site. So the bacteria enters the body through an open wound, especially if the wound becomes dirty. They can also ingest contaminated soil or droppings, and the foals can become infected from the mothers if the mothers are infected and it travels through the umbilicus. Okay, some clinical signs. It attacks the nerves and muscles. It's progressively worsening. There are 3 stages. Early, the signs are similar to hypocalcemia, which is lactation tetany, or severe myositis. General is muscle stiffness. They have a sawhorse stance, which is like all 4 legs are just completely stiff and spread out, or severe myositis. They have a difficulty moving and eating. They have the third eyelid in the inner corner of their eye starts to protrude across the eye, and they have an anxious expression and they have excessive sweating. Advanced is when they collapse because they're spazzing, and they can have convulsions and even die. And stimuli can make these symptoms even worse. Okay, now let's discuss treatment and prevention. Sadly, there is no treatment. Typically, it's fatal. Most of the time, they either die or they are euthanized. If they're diagnosed early, then treatment is aimed at destroying the bacteria so the toxin production stops, which reduces the effects of previous toxins that are released. We do this using large doses of antibiotics, either in their vein or in their muscles. Occasionally, we give an antitoxin, which is injected into the subarachnoid space. And then really, really good nursing care. We give them a quiet space to reduce their spasms, their anxiety. We give them lots of food, good nutrition, fluids, and IV meds, and possibly a urinary catheter if they are just really not doing great. In severe cases, there's something called slinging, which is when you suspend the horse's weight from the ceiling or another support. But typically the chances for recovery are poor. Okay, prevention. Tetanus toxoid. It's a core vaccine. We gave it to our donkeys. It rapidly induces strong serological responses. We give 2 injections at 4 to 6 weeks, followed by a booster at 1 year, and then continually booster them every year. If they're unvaccinated, we give them an antitoxin and then followed by the tetanus toxoid as soon as possible, or at the same time. Foals, we can protect them by boostering the moms 1 month prior to them giving birth. They produce the antibodies in their colostrum because, like I said before, it can cross the umbilicus. If the mare is unvaccinated, we give her an antitoxin to the foal. Nope, sorry, not her. We give an antitoxin to the foal either right after it's born or at 3 to 4 weeks of age, because foals can't respond to a vaccine before they're 4 months old, but we should still start the toxoid vaccine really soon after. And then, of course, good first aid. Wash your hands. Clean the wounds. Encourage deeper draining or deep draining of deeper wounds. And their environment should be kept safe. Don't, no sharp objects. Because they're horses. They like sharp objects. Okay, now let's review. Tetanus is caused by Clostridium tetani. It's found mainly in soil. It survives a long period of time in the environment and doesn't require oxygen to survive. It attacks the nerves and the muscles, causing muscle stiffness, difficulty moving, and in severe cases, collapse, convulsions, and death. Although it's most of the time fatal, it can be prevented. Vaccinate. Even though it's not zoonotic, it still affects humans too. So we also have to vaccinate ourselves. And if you step on a nail, you go get a tetanus shot. So vaccinate. Vaccines. Thank you.